Ready?
Ready. Marker. There's nothing free in this world. I'm sure we're all familiar with the expression, there's no such thing as a free lunch. I believe this is perfectly true. In this day and age, a person, whether they're medically insured or uninsured, when they encounter a medical emergency in the United States, they will never be turned away from medical care. I think this is one of the greatest things about the United States. It doesn't matter if you have paid your insurance or not. We will cover you, and with this, the Affordable Care Act plays a positive role in this. So I present to you guys the Affordable Care Act, commonly referred to as Obamacare. So prior to Obamacare and its initiation, January of 2013, about 1 out of every 5 people was insured. So that means about 44 million people in the United States were uninsured. That is a significant number. So the people that saw the difference of this were emergency medical services, emergency rooms, and this led to bankruptcies in multiple areas of the medical field. People would do one of two things when they were uninsured. They would either wait till the last minute when they had a common cold or a cough, respiratory infection, whatever, and they would wait till the last second till they were really, really sick, and they would end up being admitted to the hospital, staying multiple days. Or there would be people that would say, hey, I'm not very sick, however, I need to be taken care of. I can't afford to go to the local store to buy some cough syrup. I'll call an ambulance. And because in the United States, you cannot be sent to collections for a medical bill, this is one way to circumvent the system. Because of this, the emergency medical services took a toll. There would be a lot of people that would have legitimate emergencies, such as cardiovascular events, heart attacks, and strokes, things like that, that would be in detriment because the people that didn't necessarily need emergency care would take up the resources for the ambulances, as well as impacting the emergency medical field in the ERs. These people would take up hospital time, just as much time as somebody for a stub toe or a cough syrup, upper respiratory infection. It would take just as much time, money, and resources as somebody that was having a stroke or a heart attack. And this led to bankruptcy of multiple hospitals. I'm actually a paramedic by trade, and one of the local neighboring hospitals that was doing amazing things in cardiac heart care had to be closed due to bankruptcy because 98% of the people coming in just didn't have money. And since they weren't being sent to collections for it, they would just never pay it. And so there was really no consequence. Why did these people not buy medical insurance? They're not all bad people. They weren't out to stick it to the man, if you will, or whatever it was. Quite frankly, the high premiums of these people, because of their low-paying jobs, made it so they just couldn't pay for it. It just was out of their reach. So they did what they had to do to survive. People with pre-existing conditions were denied claims when they wanted to do the right thing, pay money to be enrolled in these medical insurance agencies, and they couldn't do it anyways. And also, in retrospect, some people that were insured were dropped just like that because they were sick, and there was nothing they could do, whether it was a birth defect, something they had acquired over the years. It just made it hard for those people to become insured again because they were already blacklisted. So Obamacare, or the Affordable Care Act, January of 2013 is when it was initiated. It benefited most people, and some people, everything remained exactly the same. People that were already insured or people that opted to not sign up for it didn't see any change at all. But however, it was a drastic change to the healthcare system as an entirety, not just the people that enrolled, but the people that also were either uninsured, who chose to do so, or people that were already insured. So big business, let's talk about big business. Since the passing of Obamacare, big business is forced to offer health care for any business having full-time employees ranging over 50 employees or above, or they would have to pay a fine. It's to my understanding that the fine actually is more than it would cost to insure your employees. So what this does is it forces the employer to promote health in the workplace. It gives them better morale at work, and it costs less than getting fined. What is Obamacare? What exactly is it? Well, I'm throwing that Obamacare and Affordable Care Act out left and right. All in all, it ensures better quality of health care for everyone. It requires medical insurance by 2014 to be had by everybody, or you will pay that fine that I discussed earlier. And again, it's a significant overhaul rather, of the healthcare system. Reform practices in the insurance companies and insurance through work or Medicare. So if you've been insured previously through your employer or Medicare will not be affected. Smokers that were denied insurance in the past were able to obtain medical insurance. They were not discriminated against for smoking. And Medi-Cal or Medicaid, if you are not from California, but we are actually in California right now, we're being expanded not to just pay for life, safety, or other things like that. The barometer is what they covered was widened. Medicare improvements happened as well. Small business owners, now they kind of have the option. If you have less than 50 employees, again full-time, you could either, the caveat being you could either go for pro-Obamacare, and you could offer to your employees, or you could not. However, there is a pretty significant tax credit available if you opt to enroll in Obamacare for your employees. Sounds like a good thing, right? Obamacare is good for everybody. How do we enroll in Obamacare? There's 3 ways to enroll. The first is the old snail mail method, where you send a letter to the information office. The other is calling an 800 number. But in this day and age, the most efficient and quick way to do it is online. So being in California, coveredca.com is the website that we all go to initiate our medical benefits. And it takes about 20 minutes, and they will kind of break down and go over the different metal plans that you would qualify for and what subsidies would be available for you. Discounts, again, will be based upon income. So if you have a certain amount of income and you have a certain size of significant other or family, that is kind of what they base what metal plan you would be going off of. Open enrollment usually ends beginning of March of the year, and it's worth noting at this time that 82% of Americans will qualify for cost assistance. So that's a pretty big, significant amount of people out there. Again, looking at the metal plans, this is the 4 different tiers that you would qualify for if you were to sign up for Obamacare. Bronze being 60% paid by the government, 40% out of your pocket. And all the way silver, gold, and platinum, 70, 80, and 90% taken care of from the government. The rest would be coming out of your pocket. And that would be covering yourself, your significant other, and your children. What will this cost America? Obamacare sounds too good to be true. What will this cost everybody now that everybody else is receiving this care and all these other resources are available? The good thing about Obamacare is people aren't paying as much as they were required to pay in the past, but they're actually paying something. So if you keep up with your Obamacare payment plans, you're actually contributing more than nothing to the system. You're not giving 0% dollars for utilizing resources that you don't necessarily need. So private practice doctors are seeing more patients. Emergency rooms are seeing more significant injury, less stuff that's not necessarily to what they're geared for. The Congress Budget Office estimated because of those things, $1 trillion deficit will be reduced. So that's a pretty significant jump. Less than 1% tax increase will happen with Medicare. And how else will this be paid for? There will be some budget cuts in different areas, but I feel that the medical field is an important field to keep everybody healthy so we can all work and contribute to our economy. Government funding, government, like I broke down with the different metal brackets, they will be doing a lot of funding. Tax increases in Medicare I touched on earlier. Added tax to insurance companies. These big insurance companies can pay, they will pay, and they will help benefit. And high-income earners, there's no way around it, they are going to pay a little bit more to circumvent what others cannot. And big companies, if they do not provide the ability to let you enroll in the Obamacare, they will be fined for it. And that money would actually go toward payment as well. So if you want to opt out, you have the option to do so. In 2014, $95 per person represents 1% of the income per family, and that's what you would pay to opt out. In 2016, it's estimated that $695 will be 2.5% of the income of the family, and that's what it would cost to opt out at that time. The Affordable Care Act, government subsidies. So like I said before, 82% of people are eligible for the government subsidies. This is a little pie chart up here representing that breakdown right there. 18% of the people will pay exactly what they were paying before Obamacare took into effect, January of 2013, or just a little bit more. The other 82% will be able to legitimately take care of themselves and their family with help from the government. In conclusion, working in the medical field, seeing things firsthand, seeing the change since January of 2013, I saw a lot of people going to medical doctors' offices, staying healthier, not wasting and exhausting the resources of emergency rooms, and I'm hoping in the future this will lead to healthier people, the maintaining of emergency rooms and not closures, and everybody to just be healthier, happier, and contributing to the economy. That's why I'm pro-Obamacare, and I hope you all feel the same. That is my conclusion. Thank you very much for listening, and I will just introduce my audience at this time.
You see name? Terry Miller?
Friend.
And just a friend, yes.
Sunita Frey, friend.
Tana Frey, friend.
Fred Garcia, neighbor.
Debbie Garcia, neighbor.
Thank you.